Chick Branch Award for the World Breastfeeding Week celebration for the year 2004 and awarded with Teacher of Teacher Award by KLE University Belgaum for the year of 2015 and Best Scientist Award by the KLE of Academy of Higher Education and the Research in the year of in between 2015 to 2018. Currently, Madam is serving as Initiating Vice Chancellor Ahir Belagavi. So with this brief introduction, I heartily welcome you for this occasion, Madam. So it's a honor and it's a privilege you are being with us, Madam. Thank you.
Thank you, sir. We now move to the Guruvandana, the dedicated segment of our ceremony where we express gratitude and seek the blessings of our gurus. This is an ancient Indian tradition recognizing that without the guru, the student's journey is incomplete.
This moment symbolizes the Shishya committing to diligently follow the path illuminated by their Guru. We request our new batch of students to come forward for the Guru Vandana. I request our Chief Guest, Honorable Vice Chancellor, Dr. N.S. Mohan Shetty, to come forward for the Guru Vandana.
I would now request the dignitaries to felicitate our Chief Guest, Honorable Vice Chancellor, Dr. N.S. Mohan Shetty.
No. Kindly address. Of course, ma'am, to kindly address the crowd. I request ma'am to kindly address the crowd.
Crowd, I think. Very good morning to all of you all. Principal, Dr. Suha Shetty, Vice Principal, Dr. Jagar, Dr. Tubake, Dr. Usha Rani, all the faculty members, and the proud students of 2025 batch and their proud parents who are in person here and online also. A warm welcome to this great institute, I should say, the oldest Ayurveda college. And it is, I shouldn't call it a college, it's truly a Gurukul. Keeping up the traditions of Ayurveda. Today, I am really honored to be here. I was not expecting that Guruvandana would be in the true ritual sense of Guruvandana. Because today, we as teachers, we only expect our students to acknowledge our presence in the classrooms. Outside the classrooms, we are not acknowledged. So this tradition just tells us as teachers the responsibility that we have towards you young students. We have a big responsibility of not only teaching you all, but nurturing you all more than your parents, I should say, because these are your formative years. This undergraduation that is there for the next 4.5 years is going to be the foundation of your future. And that is the responsibility that we have in shaping your foundation, giving you a strong foundation, and seeing that you will carry on these, not only the knowledge, but the values, the ethics that we teach you in throughout your life. We want you to be good doctors. Okay. Not only skilled doctors, but good as human beings, being a doctor. So coming to Ayurveda, today I believe all of y'all are here because you wanted to be an Ayurvedic doctor. This is the oldest traditional medicine that we have in the second BC. Can you imagine? You're studying the oldest traditional medicine, one of the oldest traditional medicine, which is not just written over days, but studying the Vedas completely and understanding the body, whatever that Vayu, Pitta, Kapha is, whatever it is, studying the catabolism, the anabolism, the metabolism. It's not easy. During those days, they have studied this science. And Charka and Sabita, you'll all know the history. One for medicine and one for surgery. They are the oldest medicines that have been written. We have a written thing about them. So for you, you are the gifted people who are going to learn this traditional medicine. What we as medical doctors learn is only allopathy, which is not very old. And that's why we don't treat diseases completely today. We in allopathy are just doing symptomatic, most of the times it is symptomatic treatment, or maybe just a little bit more than that. But you people will be looking at it from the root value and you will be able to treat diseases completely better. Today we don't, in allopathy, emergencies, yes, we definitely treat. Some surgical procedures, yes, we definitely treat. But what we are not treating is the chronicity of the disease. For example, rheumatoid arthritis, we are not able to treat it completely. Or osteoarthritis also, we are not able to treat it completely. Neither we are able to treat asthma, any chronic disease you take. we're not able to treat them completely because we are not looking at the root cause of the treatment. And even if we do, we know very little about it. Whereas you people are going to learn the details and all these chronic diseases, whether it is diabetes, hypertension, or even your heart ailments, etc., which are burning causes today. They are the main causes of death. We are having a good aging population, and these are main causes, including dementia, mental illnesses, etc. You have better answers to those diseases than allopathy has. So if you concentrate during your next 4.5 years on these type of problems, you will be a very successful Ayurvedic doctor. So my plea to you all is, don't get into that sort of, I should not use the word lateral entry to allopathy. It's not going to get you anywhere. Please concentrate on the Ayurveda, learn Ayurveda properly, practice it properly. You will have answers to many diseases. Your patients will be there with you forever, and they will be more grateful to you than the allopathy doctors. Because we are moving, and that's why the country has realized now that Indian knowledge system, under the Indian knowledge system, that we do need alternative medicines for diseases to be treated completely. And this is not only in India, it is all over the world. If you go to US or anywhere else, they are looking towards alternative medicine. They always looked at Chinese medicine, they always looked at homeopathy medicine. What we need to promote today is Ayurvedic medicine. And we need to put it globally. And that's why rightly the UGC and the other, even our NMC, National Medical Council, which regulates the allopathy medicine, it has introduced Indian knowledge system of medicine and has made it compulsory that we also should know alternative medicine. I'm not calling it alternative, actually, it is the true medicine that will treat most of the diseases. So you youngsters here should keep that in mind. 4.5 years should be devoted to Ayurveda, and subsequently you can practice, I mean, you can specialize, okay, but there is a lot of scope in this medicine, and see that you promote it not only in our country but globally also. So with this, I'm sure today, after wearing the white coat, which is the dream of all your, of these 12 years, or I should say the last 17 years, what you have struggled for to enter into a professional course, not only of yours, but your parents also. So make the best use. We have one of the best Ayurvedic colleges in the country. And under the leadership of not only Dr. Suhas Shetty, even the previous principals, they have really set up a very good infrastructure, a very good patient load, everything that is required for your career. Soon, you must have seen the spa center. It is like a 5-star hotel. And soon you will be having a very good skill lab also. So we have patients not only from local Belgaum, but even international patients. So you will get all the scope to study well and all the exposure to have the good clinical experience. So I'm sure after you pass out from here, you will definitely do well in your life, provided you utilize this 4.5 years very well. So congratulations again for getting admitted to this prestigious Kanwadi Ayurvedic College. And I wish you all a very happy stay for the next 4.5 years. And also all the best to come out in flying colors. Thank you for having me.
Thank you, ma'am. Thank you, ma'am. We now arrive at the white coat ceremony. The white coat is a powerful symbol. I would now request Dr. P.G. Chadha Sir to tell us about the importance of the white coat.
A very good morning to all. I want to congratulate each one of you on arriving at this milestone in your career. You have no doubt worked hard to achieve your goal of entering Ayurveda Mahavidyalaya. As each of one of you walk across this stage today to receive your white coat, your journey in medicine will begin. The white coat ceremony is a rite of passage welcoming you as a new medical students into the medical profession. As medical students, you are bound by the same professional commitments that bind all physicians. This ceremony will join the symbol of the white coat with the virtues of altruism, that is unselfish regard, responsibility, duty, honor, respect, and compassion. White color representing a purity is a virtual reminder of the doctor commitment to do no harm. White represents goodness. It also conveys cleanliness and connotes a purging of infection. Further, the white coat symbolizes seriousness of purpose also. The short length of the white coat worn by the medical students and the full length ones worn by the most postgraduates and the most physicians is a long-standing tradition and remains a mechanism used by the patient to identify the role of each care provider. Hope this white coat ceremony is to promote both professionalism and humanism in the Ayurvedic students as they begin their education. Thank you.
I think students are waiting when our turn comes. All right, coming to the most anticipated occasion and the milestones, and of course the responsibility. So I now ask the students of UG-25 batch to raise for donning the white cloth. Yeah. Yeah, yeah. Yeah. So kindly put on your apron. I think your parents will be feeling proud online. Offline also there. Okay. Thank you.
I would now like to request our principal, Dr. Srihastina Shetty sir, to address the gathering.
A very good morning to all of you. Most respected Dr. Niranjana Manshetty, Madam, the officiating Vice Chancellor for University, my colleagues Dr. Tubaki, Dr. Jadar, and Dr. Usha, all the head of the departments, faculties, and all my dear 2025 batch undergraduate students. It's a great honor for all of you to have a very special day, a momentous day for all of you when you have this honor of wearing this white coat for the first time. It's a dream of all the students to be endowed by this white coat. As rightly mentioned by Dr. Jada, it symbolizes the purity, it symbolizes goodness, and also probably gives you more responsibility to go ahead with lot of kindness, compassion, and the care for all your health seekers. And you're really proud that you are part of our family for the next 5.5 years, and thereafter for the entire life where you're connected with our institution. As you all know that this institution in the recent QCI ranking was ranked 8th in the country and the 3rd in the state. And in fact, when we take the analysis of in the North Karnataka, Southern Maharashtra and Goa, we are the first ranked institution also. As you know, always the guiding source for Honorable Chancellor Dr. Prabhakar Kore has always been so passionate and so connected with our institution that he always had given that special status to our institution to have the best, whatever the institution that demands, especially for the care of the students, for the well-being of the patients. So he has provided us all as the best possible facilities through all possible support that we can get from our Keli Society as well as our university. And through university, with the leaders like Mahan Shetty Madam and all the previous Vice Chancellor, Registrar, and all the senior members of the university has always been very having that special guidance and special support for our institution. On behalf of all the faculties and students, I would like to thank the university officials for all the kind support. As you all know that the institution is definitely trying to progress with much passion towards making this epitome of the education and the hub of the care. Very happy to say that we already have few patients from Holland, madam, who are taking the treatments, and we had around 7-8. And last month we had around 7-8 patients from Brazil also. So it's a continuous now. Now that there is a great opening for even the Ayush visa, the patient can come through this Ayush visa and get the treatment for in any of the Ayush hospitals. And you all know that now we are a part of Heal in India and Heal by India initiatives, and we are already we have recognized also. We are the institution also recognized for the insurance also, like we have the Rohini insurance registry also, which we have done. And very recently, around 4-5 months back, we are the first institution in the northern Karnataka, the teaching hospital, to be recognized by the state government empowerment panel. Now, any person who is working in the state government there are more than 52 departments in the state. Any of these people can come to our hospital and get admitted and get the treatment and get reimbursed by our hospital. For that, the institution has been recognized or empaneled by all the state government departments. So all this definitely would bring more number of health clients to our institution, which basically will empower our young students. As you all know, this hospital is a teaching hospital, basically for the teaching and training of our students. So make the best use of such opportunities. We have the excellent team of faculties who are always there to help you, mentor you, guide you. So, but at the same time, the medical profession is more of a student oriented, where you need to have that zeal and hunger to get more and more knowledge from your teachers. So have that appetite for knowledge and have that zeal for learning, have the passion for empowering yourself and develop the skill. So all your teachers will be very, very happy to guide you, mentor you. And as a symbol that we conduct the Guruvandana also, like where we probably, that's a kind of respect. Because as you know that the generation has been changing. We call you as the Gen Z generation but you all have been very much gifted with so much of creativity, digital technology. You are very, very even in how to use mobile inside the class also, you are very expert. But don't do all those things. We are here for purpose of learning. At the same time, one of the biggest challenge that we have with present generation is sometimes they lack the patience. No, they want everything to be at the click of a button. But sometimes all the things sometimes need some time. Okay, so that's the reason why always have the patience. I will, always to give some time to yourself, time to things to settle down, so that everything will get into track. And for anything, you always have the mentors, you have the professional coordinators, we have the senior administrators who are always there to help you and support you to ensure that we have a very safe and a very comfortable environment inside the campus for all of you. So we will ensure that you are very comfortable, and all the nurturing environment that is required for you for your knowledge will always be taken care by the administration, as well as duly supported by the university. Wish you once again all the very best for your future. As you all know that the medical profession is one of the most gifted professions, and once you go to the society and community, you have a lot of responsibility. So with that passion and with that the fire within you to learn and gain the best knowledge, may you all utilize all the best facilities that we have in the institutions. You do your best to nurture yourself, and especially I would like to thank all the parents who, in spite of their busy schedule, has joined us both physically as well as online. No, it's a very proud moment for even for them also, just as they are very proud. Even all our faculties and teachers are also equally proud about you, and wishing you all the very best. And once again, I would like to thank Manshetty Madam for her valuable time for joining us for this special moment. Thank you very much.
Thank you, sir.
Come to a conclusion of this event, I would like to request our Dean, Tubaki sir, to deliver the vote of thanks.
Good morning to one and all. Once again, I congratulate all the undergraduate 25 batch students for getting into this previous milestone of white donning ceremony. And also at the same time, congratulate the parents for this. And I thank the organizers for giving the opportunity of the vote of thanks. Firstly, I present my vote of thanks first with the one of the most committed person for Ayurveda, that is our Chancellor, Dr. Prabhar Korezi sir. So his commitment and Rajashriya for Ayurveda is even more than what I feel ours. So we can see a lot of infrastructure, everything is coming up from pharmacy, world-class pharmacies and hospital, college building. I think your batch will be the most, the batch which are going to get the dividends of this all the pleasures. And next, I would like to thank our Honorable Vice Chancellor Ma'am, Niranjana Mansetti Ma'am, for accepting our invitation and gracing this occasion. And also, I would like to thank Ma'am for accepting the Guruvandana program and following all the rituals. I think Ma'am was a bit surprised. So, but still accepting the Guruvandana program for young batch scholars. And again, for the UG-2025 batch, I think it's more privilege. So, because Mansetti Ma'am is getting the white coat from under Mansetti Ma'am, and also this, I think if I'm not wrong, this first time Ma'am is visiting our campus after getting the position of Vice Chancellor Ma'am, and this makes your batch still more privileged and proud. I thank you, Ma'am, for all accepting our invitation and gracing the occasion and giving us the valuable and wisdoms and words of advice to our students. And I would like to thank our young energetic, positive, motivating principal, Dr. Suhas Kumar Shetty sir. And I would also like to thank our Vice Chancellor Jadis sir for his dedication. Sorry. Vice Principal. Actually, the word missed because I tried to search out a word which suits Jadis sir. So, Vice Principal Jadis sir, for his commitment, hard work, dedication, and discipline. That's his benchmarks. And again, I would like to thank Coordinator Usha Toshani ma'am for so beautifully conducting, and also the coordinator for beautifully conducting this the program. I'd like to thank all the staff and everyone for cooperating, and even the non-teaching staffs, and of course, last but not the least, so all the UG-25 batch and their parents for involving in this program and for their active participation. Thank you.
Thank you, sir.
I request all the dignitaries, students, and staff for group photo at the hospital entrance. Thank you all and all for joining this program. Thank you.
No. 1, 2, 3, start. 1, 2, 3, start. Start. 1, 2, 3, start. Thank you everyone for joining us today and making this ceremony a memorable one in our medical journey.